And joining us in the studio is Kim Shaw, who's the Director of Nursing, right?
Director of Nursing for Hannibal Regional
For Hannibal Regional Hospital, home health care.
Correct.
Okay. And we were talking about home health care this morning. Thanks for joining us.
Well, thank you.
Tell us a little bit about what home health care is.
Home health care is ordered by a physician, and it is given in the patient's home by professional staff such as a skilled nurse or physical therapist, occupational therapist, providing skilled services that the patient needs.
And why is it better to be at home having those services versus in a facility?
As the saying always goes, home is where the heart is, and home is where a patient is more comfortable. And so when a patient is at home, they're more relaxed, they're going to get more rest, because in a hospital you don't get the rest that you need. You're getting blood taken, you're having x-rays done, you're constantly not being bothered, but you're being taken care of at the hospital. But at home, it's more of a relaxed environment where you can rest and kind of get your bearings back on.
It probably depends too on coverage, on benefits as well, as to what you have available at that time. Is that right?
In a way it is. Medicare does pay 100% at this time for home health services to come into the home. Medicaid pays a percentage of those, and a lot of insurances also pay for home health. They may have a copay, but a lot of insurance does have home health coverage.
Okay. Do you go out of state?
We do. We have 2 counties in Illinois, and we have 8 counties in Missouri. And the counties in Illinois are Adams and Pike.
Right here at home. What kind of services can be provided at home? Are they limited?
No, we are able to provide skilled nursing, occupational therapy, physical therapy, speech therapy, medical social worker, a home health aide, and a dietitian. We're able to provide all those services, and they can come into the home and work with the patient as well.
And is it by doctor order as far as the time involved, or by insurance? Does it matter?
Kind of both. It's physician ordered. Everything that we do has to have a physician's order. But as far as the time, we will set goals, and once the patient meets those goals, and we coordinate with the physician during the whole time about how they're meeting their outcomes, meeting their goals, and when we've met those goals, we can discharge them or send them to outpatient therapy if they're continuing to need therapy. A lot of insurances will tell us, okay, we'll give you 5 or 6 visits of nursing and 6 visits of physical therapy, but more generally, they are allowable to more than that once we get in the home and we give them an update, and they're like, okay, you can have more visits. So it's pretty easy to receive those services once they're ordered.
And do patients have the opportunity to choose which service they use, or do
they can? They're supposed to be able to give an option if they're in the hospital of what home care agency they would like to have. There's several in the area. There's hospital-based ones, and as well as county-based home health agencies. And you know, they have the choice and they have the option, and I'm hoping that they choose us.
Sure.
Kim, you mentioned home is where the heart is. What else is so valuable to a patient being at home?
The patient has the opportunity to be at home and say, we want them to help drive their care. We want them to say, this is what my goals are, because their goals are usually different than what our goals are. We want to go in when it's going to be convenient and comfortable for them. We're respectful of their environment, and it's their home. It's where they are comfortable. It's not the hospital where it's cold, where it's noisy, where they're being not bothered, but they're continuously having somebody in the room.
Yeah, they're not in their comfortable environment.
Right.
Can they specify when they want you to come and how they want things to work?
We definitely get their input. There are times where it's not always feasible if they want like a 5 o'clock in the evening visit, or if they're wanting something first thing in the morning. We try as much as we can to get our services in there when it's available, but at the same time when it's time conducive.
And what's going to help them reach their goal?
Right, right.
Okay.
And is this something that's coordinated then prior to leaving the hospital, so it's all set up? They just need to go home and
home health is set up before they go home, and we will call the hospital or the physician's office, get the report that we need to kind of find out what's going on with that patient, what to expect, any special needs that we need to take care of while we're there. And then the nurse goes out. Our priority is to get them seen within 24 hours of hospital discharge.
Okay.
Are all home health care agencies the same? Do they all tend to operate the same?
Not necessarily. There are what is called in-home agencies, and those are more private duty, the shopping, the med setups, the house cleaning. That isn't what we provide. We provide the skilled services such as the physical therapy, skilled nursing. Our job is to go in and make a difference and be able to improve that patient's life to get them back to their previous level of functioning.
And can you give referrals if they're interested in your services, obviously, but then also some of those others that you don't provide, like the
That's
house
right.
cleaning?
We will help set them up with those services that we don't provide in the meantime. And especially when we get out, if they're still needing some services that those other in-home agencies can provide, we will help set that up as well.
Your organization has received an Excellent in Healthcare Award. What does that mean?
We send out surveys through Professional Research Consultants, or PRC, and they do a patient satisfaction survey. They're constantly calling our patients and asking how they thought we delivered care. And they gave us a top performer award for the nation back in June, and that was in Omaha, and we went to receive that award at that time.
That is excellent. Well, it's excellence in healthcare.
Excellence in healthcare.
Yeah, it's got to be excellent. That's great. And patients can choose the home health care agency that they want, too. You mentioned there are differences.
Right.
Yours, obviously, is excellent. So what can people do if they want to choose Hannibal Regional Hospital Home Health?
If they're in the hospital, they need to contact the social worker, tell them that that is the agency that they would like to go home with if home health is ordered, or they can contact their physician's office and they can make the referral to us.
And is home health care available everywhere?
It is.
Okay, all across the country.
All across
you have
the country.
The option, and
You do.
And here you have Hannibal Regional Hospital Home Health available.
That's correct.
All right. How can people get more information?
They can contact me at the office at 573-221-6515, or they can visit our website at hrhonline.org.
Okay, that was Kim Shaw.
All right, Kim, thanks for joining us this morning. Kim Shaw, the
Thank you very
director
much.
of Hannibal Regional Hospital Home Health. Thanks a lot for coming to Studio H.
Thank you.
Enjoy
Glad to be
your
here.
weekend.
Thank you.